Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Bird diseases and risk of bird droppings. Birds can carry various infectious organisms, including viruses, bacteria, and parasites, some of which are transmissible to humans through bird droppings. Contracting zoonotic diseases, diseases that spread from animals to humans, from birds, can occur through direct contact with the birds or their droppings, or indirect contact, such as inhaling airborne particles from dried feces or feather dust of infected birds. /r/n/r/nPixelsEffect, Getty Imagesrnrn Birds can carry infectious viral, bacterial, fungal, and parasitic diseases transmissible to humans. Zoonotic diseases, or zoonoses, are infections that pass from animals to humans. While some zoonosis birds carry can cause mild illness in humans, others pose serious public health concerns. /r/n/r/n Anyone can contract an infectious disease from birds or bird droppings, but the risk is higher for people who work with birds, as well as children, older adults, and those with weakened immune systems. /r/n/r/n Also known as bird flu, avian influenza is a viral infection caused by influenza A viruses, some of which are transmissible to humans. Infected birds shed these viruses through their feces, saliva, and mucus. /r/n/r/n Humans can develop an infection when the virus enters their nose, mouth, or eyes after direct contact with infected birds, touching contaminated surfaces, or breathing in air droplets containing the virus. In humans, bird flu causes a respiratory infection ranging from mild to severe and life-threatening. /r/n/r/n Also known as parrot fever, psittacosis is an infection caused by Chlamydia psittaci. This disease most commonly transmits to humans through exposure to infected pet birds, such as parrots, cockatiels, and parakeets, as well as poultry, for example, chickens, ducks, and turkeys. /r/n/r/n The bacteria can spread to humans through direct contact with an infected bird or its feces, or through inhalation of airborne particles of bird droppings containing the bacterium. In humans, psittacosis infection can range from mild flu-like symptoms like fever, muscle pain, headaches, and dry cough to severe pneumonia. /r/n/r/n Salmonellosis is an infection caused by Salmonella bacteria. Salmonellosis is primarily a foodborne disease, but about 10% of all cases develop from direct contact with infected animals, including birds. Though rare, humans can contract salmonellosis from direct contact with infected birds or bird droppings. /r/n/r/n In humans, salmonellosis causes gastrointestinal symptoms such as diarrhea, fever, abdominal pain, headache, nausea, and vomiting that resolve within 2 to 7 days. However, in children, older adults, and people with weakened immune systems, it can progress to a severe, life-threatening infection. /r/n/r/n Cryptococcus is a fungal infection caused by Cryptococcus neoformans and Cryptococcus gattii. Birds, particularly pigeons, can carry these fungi, infecting humans who come into direct contact with an infected bird or bird droppings. While the disease primarily affects people with compromised immune systems, otherwise healthy people can also contract the disease. In humans, Cryptococcus initially affects the lungs, causing mild chest pain and coughing. /r/n/r/n If the fungal infection spreads to the brain, skin, bones, or urinary tract, symptoms can include /r/n/r/n blurred vision, fatigue, fever, excessive night sweating, nausea, confusion, abdominal pain and swelling, petechiae, red spots on the skin rash, loss of appetite, and numbness and tingling. /r/n/r/n Histoplasmosis is a fungal infection caused by Histoplasma capsulatum. This fungus thrives in soil where there are large amounts of bird droppings. Human histoplasmosis infections develop after inhaling fungal spores in dried bird droppings. The spores become airborne when the infected soil is disturbed, such as during gardening or yard work. /r/n/r/n While most people exposed to these spores do not become ill, some may develop a mild flu-like illness with symptoms like fever, cough, fatigue, chills, headache, and chest pain that resolve within 1 to 2 weeks. In people with weakened immune systems, the infection can spread to other body parts and cause more severe illness, including fungal meningitis. /r/n/r/n Cryptosporidiosis is a parasitic infection caused by ingesting Cryptosporidium moa cysts, which are microscopic parasites. Humans can develop a cryptosporidiosis infection through water, soil, or contact with surfaces contaminated by infected bird droppings. /r/n/r/n Cryptosporidiosis symptoms develop within 2 to 10 days after exposure to the parasite, including severe watery diarrhea, abdominal cramps, nausea, and vomiting. The infection typically goes away within 1 to 3 weeks but can become chronic or life-threatening in people with weakened immune systems. /r/n/r/n It's a common superstition that getting pooped on by a bird is good luck, but the reality is that it poses health risks. The risk of infection from touching bird poop is low, but it's always best to err on the side of caution. Promptly washing your hands and other skin areas that come into contact with bird droppings with soap and water is a simple yet effective way to lower your risk of infection. /r/n/r/n Bird feathers can carry pathogens that pose health risks to humans, including bacteria, fungi, and viruses. These can spread through direct contact with contaminated feathers or inhalation of airborne particles on the feathers. Use protective gloves and wash hands thoroughly after handling feathers to help reduce the risk of infection. /r/n/r/n Bird feces can carry harmful pathogens, including bacteria, fungi, parasites, and viruses. Disease transmission from bird droppings typically occurs through direct contact, ingestion, or inhalation. /r/n/r/n Direct contact involves touching contaminated surfaces or objects and touching your mouth, nose, or eyes. Some pathogens can enter your body by inhaling airborne particles from dried bird droppings. /r/n/r/n If you come into contact with bird feces, you can lower your risk of infection by taking the following steps. /r/n/r/n These symptoms can vary depending on the specific disease contracted. It's essential to monitor your health and seek medical attention if you experience any of these symptoms after coming into contact with bird droppings. /r/n/r/n Treatment for diseases contracted from bird droppings depends on symptom severity and the type of infection, for example, bacterial or viral. In healthy people, the body's immune system can effectively fight off mild cases of some zoonotic diseases. /r/n/r/n People with weakened immune systems, older adults, children, and those experiencing moderate to severe symptoms may require treatments such as /r/n/r/n Those who work closely with birds, such as veterinarians, wildlife rehabilitators, poultry farmers, pet bird owners, outdoor workers like landscapers, farmers, and construction workers, and people who spend time in areas with high bird populations, are at increased risk of contracting common zoonotic diseases. /r/n/r/n Although the risk of getting an infection from birds is low, it's still important to practice good hygiene and exercise caution after exposure to sick birds or their droppings. /r/n/r/n Both domestic and wild birds can carry diseases that spread to humans, including /r/n/r/n After contact with a sick bird, it's important to be vigilant for symptoms of infection, including /r/n/r/n See a healthcare provider promptly if you develop any symptoms after contact or exposure to sick birds. /r/n/r/n Treatment for diseases contracted from sick birds varies by the type and severity of the infection. Mild infections may resolve with time and self-care measures, such as hydration and rest. Some infections require antibiotics, antiviral, antifungal, or antiparasitic medications. /r/n/r/n Proper bird handling can help lower the risk of disease transmission to humans. Whether dealing with pet birds, wild birds, or poultry, certain precautions can help protect both handlers and the birds themselves. These include /r/n/r/n Birds can carry harmful bacteria, fungi, parasites, and viruses transmissible to humans. Direct or indirect contact with infected birds or contaminated bird droppings can transmit infectious diseases to humans, causing respiratory or gastrointestinal illnesses. /r/n/r/n To prevent infection, avoid touching bird droppings, wash hands thoroughly after contact with birds or their environments, and disinfect contaminated areas. See a healthcare provider if you come into contact with birds or bird droppings and develop symptoms of zoonotic diseases. Most people recover quickly from common bird diseases, but people with weakened immune systems can develop more serious illnesses that require prompt medical attention and treatment. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.